This is KARE-11 News at 4.
Well, still ahead, tips for keeping colds and flu away unless you already have it. We have some helpful treatment strategies.
Still ahead, the flu off to an early start. Tips for prevention and treatment for the virus as well as the common cold. You may have heard flu season is off to an early start around the country and including here in Minnesota. Compared with last year, the Minnesota Department of Health says the number is high with 30 confirmed cases of influenza here to date. 8 cases in the past week alone. Karin Evan, ear, nose, and throat doctor with Specialty Care of Minnesota, is here with some timely advice on how to keep healthy. A lot of people think, oh, there's nothing I can do to stop myself or my children from getting sick. You're saying, no, that's not true. You can actually take some steps.
Absolutely. And some of the basic things that we heard from Mom are true. Keeping hydrated, eating well, water-rich fruit and vegetables, and keeping our hands clean. And it's important to use things that we throw away, sanitary wipes, Kleenexes, as opposed to sponges that sponge up those germs.
You know, and I have to look at this one right here, the disinfecting wipes. A lot of people, I think unless it involves water, it's not going to do a thorough enough job. Is that true, or what would you say from your medical perspective?
Alcohol kills germs, and most of these wipes will have alcohol in it, so that is really probably better than water.
Okay, so that's okay. If you don't have a sink nearby, don't have a faucet, you're okay to use those wipes, especially with children when you are out and about and they are touching absolutely everything. So important. Kleenexes, you said, of course, you want to be able to throw them away, dispose of them immediately, or get them out of the way. So
absolutely.
Okay.
What I feel really strongly about, and what people have heard about this type of thing, but nasal washes, I think, can be incredibly helpful, both for prevention and once you start feeling a cold coming on, having the duration shorter. And improving your symptoms during that time.
Okay, so we talk about these nasal washes, I think, or rinses. I think that sometimes people, again, are a little overwhelmed by the concept. But you actually have products here where, maybe describe a little bit about what happens. So for the people who are a little intimidated by this, and you aren't alone, they can get an understanding of what is involved and what it actually does.
Well, I think knowing what we're doing makes all the difference in the world. Our mucus is in our nose to move out, to catch germs and move it out. When we're healthy, we don't even notice that process. When we start feeling sick, the mucus gets thick, globular, and we blow it out, and the volume is a lot higher. So the idea is to restore that flow.
Okay, and that's what that does.
So people have heard about a neti pot. That's a pouring technique. Alkalol is a great additive. It's non-prescription, medicated, has kind of a tingling, invigorating feeling, and they have a small pouring technique, and then there are also squeeze bottles. I think options are really important. What people feel comfortable with, they're going to use again. And lukewarm water that you've boiled ahead of time or distilled water would also be important to use.
Okay, so your advice again, stay hydrated, make sure you clean up after yourself and wash your hands frequently, and also perhaps use the nasal rinses.
Absolutely.
All right, thank you so much, Karin, for joining us. We appreciate all of that advice, very important.
Thanks, Carla.
We have all Dr. Evan's tips on KARE11.com. Click on the 4 p.m. homepage, and folks, we will be right back.